If you've ever felt like you're living a life that wasn't quite yours or carrying burdens you didn't choose, then you're in the right place. I'm Barbie Wolf, and this is Unboxing Barbie, the podcast for cycle breakers and comrades with our boots on the ground. It's a space for honest conversations about healing, faith, and becoming who we were always meant to be. Let's unpack some things together. Today, I'm sharing a conversation with someone who has been a pivotal partner in my own journey of reconstruction and repair, Dr. Morgan Elizabeth Lyons, who I will call Morgan from here on out.
Please.
She's a DO, a doctor of osteopathic medicine, practicing internal medicine, and she has been my primary care physician since 2017. Fun year for both of us. Yeah. Our relationship began in a moment that I don't think either of us will ever forget. A moment of pure, unboxed chaos that involved a brand new baby and a surprising act of trust right as she was about to walk through the exam room door. In that moment, something shifted. I felt a wave of recognition, and I knew with absolute clarity that she understood not just the mess, but the deeper reality of what it meant to be sitting there as a patient, a caregiver, and a human being navigating a life far more complex than any chart could show. What I've come to cherish most about Morgan, though, is her profound humanity and her ability to see the whole person. A philosophy woven into the fabric of her medical training as a DO, receiving all the same rigorous training as MDs, but also completing hundreds of additional hours in OMT, osteopathic manipulative treatment. And the core philosophy behind this approach is the very essence of what Unboxing Barbie is all about. You cannot treat one part of a person in isolation. This philosophy recognizes that the body, mind, and spirit are an interconnected unit. It understands that if you're carrying deep emotional stress, it might show up as physical pain. It knows that to truly help someone heal, you have to see the whole integrated person, not just a collection of symptoms. And that is exactly what we do on this podcast. We know that our physical health is never just physical. It's interwoven with our faith, our emotional trauma, our family systems, and our journey of repair. Unboxing Barbie is about looking past the plastic exterior to understand the intricate, messy, and resilient reality inside. It's about the slow and sacred work of reconstruction. Dr. Lyons has been a trusted partner in my own unboxing. She has sat with me, listened to me, and fought for me, always honoring the complex reality of my life. She and her partner also have a deep personal understanding of the many paths to building a family, including foster care and adoption, bringing this beautiful blend of medical expertise and lived experience to their care. So today, we're pulling back the curtain on the doctor-patient relationship. We're talking about what it means to be seen, what it takes to build trust, and how true healing happens not in a vacuum, but in a partnership. So please join me in welcoming the wonderful Dr. Morgan Elizabeth Lyons, who I said I was going to call Morgan from here on out, but it's all right.
I'll go by any name.
Yeah. Morgan, thank you so much. Thank you so much for being here. And before we dive into what we were going to talk about, I feel like I have to start by cracking open the reality of this exact moment. As we're talking, for my listeners, I'm sitting at home giving myself one of my bi-weekly subcutaneous infusions. I do this on my own, and the only reason I'm doing it in the middle of my workday today is because the shipment was delayed by several days, which is unusual and has completely thrown off my schedule. And just to paint the full picture of the day, I woke up with a migraine this morning, which, as you know, is a regular part of my rhythm. I wanted to share all that because this is the invisible reality of living with chronic illness. It's this constant juggling act, the resilience I have to find to show up for the work I love to do while managing the logistics, the pain, and the self-care that no one else sees. So as my physician, you know about these infusions.
Yeah.
But this gives you a real-time glimpse into like what it actually looks like in my day-to-day, what the box looks like. And, when you hear about these layers, like the self-administration, the stress of a delayed shipment, navigating the aftermath of a migraine, what does that illuminate for you as a doctor about the sheer amount of work and resilience your patients are managing outside their 15 minutes they have with you in the office?
Yeah, I think I had quite a bit of experience going into medical school. Luckily, I lived some life in between undergraduate and graduate school. So I had some experience, but I also, including being a home health aide. So I worked as a CNA in people's homes. And so I had a profound experience of working with folks with chronic illness even before becoming a doctor. And I think that that's essential. I trained with some physicians that really went straight through, went undergrad to medical school and, did very little volunteer time. And that makes a huge difference. It really does, in knowing that what it's like to live a life that is filled with either pain or complexity or trauma. And I think that I've always seen and known that for, I would hope the majority of my patients that I can understand that because I came into medicine that way. And I do forget that about you because you are so highly functional that I don't see you as a set of complex medical diagnoses. So when you say, that about me, I think, oh, right, I do. But it's not the first thing that came to mind. I think it's more the resiliency. I think it's more the juggling, the superwoman holding it all. Of course, she's giving herself an infusion and post migraine because that's what you do and I've always done. So it's interesting that you would start with that
I
because I
know.
don't see the list of diagnoses. I see you just handling yet another ball thrown at your face.
Yeah. Oh my gosh. That is so cool. And I appreciate that about your background, which is going to, I have to share something that happened too as I
Mm,
was preparing for our other podcast interview, the one for It's Just Hair.
mhm,
It's a little embarrassing for me to admit, but it's beautiful. For years, I sat in your office and I've always seen you, seen your face, saw your
mhm,
name, but I never really paid attention to the letters after your name
mhm.
until I was doing the research for that interview.
Yeah.
And then I was like, what the heck? Hit me like a ton of bricks because I've been profoundly underutilizing the gift of your care. So, my first question is personal.
Mm.
From your perspective as a busy practice, how often do you get to integrate that hands on osteopathic side of your training into your internal medicine?
Not as much as I used to. So when I first started practicing in Oxnard almost 13 years ago, um, we had an osteopathic manipulative clinic. So an OMM,
Whoa.
OMT clinic. And that shut down during the pandemic and they never relaunched it.
Oh,
So I had a full clinic um, dedicated to hands-on manipulation. Because, and the truth is that a an exam table in a Western medicine office is not really great for osteopathic manipulation. And so we were
I
allowed
was
to use.
trying to imagine how you would.
Oh, right, exactly. And even the ones we used when we had a dedicated OMT practice, we used the bariatric tables, which were more manipulative and we could do more with them, but they're still not truly dedicated OMT tables. I do still use some, but again, it's also time. So I used to be able to make more space in my schedule. And as medicine has progressed to what it is now, I have 20-minute slots for new patients, for old patients, for complex, for, just a review of labs. So sometimes I don't know how much space I'm going to have, but I still try and do minimal OMT. And I have to say the majority of OMT that I get to do is either on family or colleagues. I have my colleagues still seek me out for treatment of acute muscle spasm, or trauma or those types of things. So I do still integrate it. It's just not as much as it used to be.
That is so cool, though.
Mhm.
That is so cool.
Mhm.
Okay, Morgan, I mentioned in the intro that our first meeting was a moment of pure unboxed chaos. And I've told this story from my side before, but I am
Mhm.
super curious to hear it from yours.
Mhm.
Can you take us back to that day when you opened up that exam room door and I handed you that 5-pound baby?
I remember feeling that you were a person who was going to be honest about where you were. And that's not always true. I think some people meet medical providers and think of us as either enemies or authoritarians. And I think you gave me right off from the bat that was not how our medical relationship was going to go, and that you were going to show up as 100% yourself, and that you weren't afraid to show me chaos. And I really admired that because I think a lot of people try to present themselves oftentimes in first impressions as the best version of themselves and even in second impressions and third impressions. And I just got that feeling of that you didn't have time or energy to present as anything other than you were. And I really admired that.
It's so funny because I think I did. I think I even had makeup on that day.
Mm.
But she just puked
Yeah.
from front to back
Yep.
everywhere she could
Yep.
have. And there's like, okay,
Mhm.
well,
Mhm.
here we are. That's
Mhm.
so cool. And so you actually answered my second question because I was going to ask you beyond that, how did it like compare to what you saw on my chart?
Yeah.
Because I know you don't get a lot of time to
Yeah.
review a chart. And I have a lot of history with the Ventura County Medical Center. So
Yeah.
I was just curious, like I mean, I guess maybe that answered it.
Yeah.
Unless you
No,
have any things.
I think, what I want to add is I have a funny relationship with your medical, like not specifically yours, but anyone's medical history, because it does tell a story and it's an important one, but it is not the whole story. And I think as a medical practitioner, it's important to read, be up to date, but not spend so much time knowing people's diagnoses that you forget that the person in the room may not be anywhere close to summative of what their diagnoses are. So I think at the time I thought complex medical human. And then I always laugh at myself that really, truly, I have to keep out of my own head, and that assumption is not a good medical tool. So to note them, register them far in the back of my mind, and then let you tell me the rest of the story because the medical charts tell such a small percentage.
They really do.
Yeah.
They really do. And I think that there's so much complex information that can even be transferred in a moment, just in a quick, a real honest glance.
Hmm.
And so I don't know. I feel like our relationship obviously has evolved from purely clinical to friendship, but
Yeah.
was there a moment or a specific interaction where you felt like it crossed that line for you?
That's an interesting question. So I think we had some friends in common, and I knew that through social media. And we talked about I always vary the amount of personal information that I give in medical visits
Right.
about myself for a couple of reasons. One is my safety, but also for taking up emotional space, right? So when at least for me, when I'm a medical provider in a room with someone who may not have been believed or may have been traumatized by the medical community, I'm very cautious to not share more than I think is necessary to make someone feel safe because I don't want to take up too much emotional room. So I think it was the point at which we started talking about parenting,
Yeah.
and it was allowed to be a conversation. I think you allowed it to be a conversation. And I remember it was just a conversation about parenting young children and how overwhelming, and you made room to talk about that you were parenting young children again. And I think, but you made room for me to say, I'm parenting young children and children who are going to carry some trauma. Um, and you made room and were interested in my part of the story. And I think that's where it shifts for me, is that it becomes more of a friendly conversation. Then obviously when you invited me to do the first podcast, I was like, well, okay, we're just going to have to make sure that we know what the boundaries are. Cause
Yeah.
it is still, I still very much, want to protect your space, right?
Yeah.
Because friendship space is a shared space, whereas medical space is there for a purpose, and
Yeah.
I'm only supposed to show up to a certain extent there. So,
Yeah.
but definitely those were the gradations for me of friendship.
Yeah. I remember this one conversation where you were having a tough time with one of yours and
Yeah.
you just took the mask off and we're like, oh, shucks.
God,
Wait
who
till
parents? This is stupid.
wait till their prefrontal cortex forms and they'll be fine. Fine. No. Oh, that's so cool. So I have seen a look from doctors over the years, whether it's dentistry, because I worked in surgery.
Hmm.
So I know the lingo.
Hmm.
And I often get a moment where doctors recalibrate. They're like, who is she? What does she know? Why is she using medical terms? How much does she know? Like, is she, all of this. So I'm just curious, when you first met me and I started using clinical terms to
Hmm.
describe my history, and you knew that my language was a little bit more expanded than
Hmm.
an average patient, whether it's from a patient expert or from working in the industry or in care,
Right.
how did that in the trenches fluency affect your trust in me as a narrator of my own story?
Ooh. It's This is a great question. So I think there's a great line, and it's the nuance of it is, can you use the vocabulary, and how attached are you to the vocabulary? And in your case, you knew the vocabulary, but you were open to what that meant. There are folks who's are very attached to the medical terminology and to the description, and their whole lives become their diagnoses. And for me, it was a shortcut. And it was obviously that you spoke the language so we could have a more rapid conversation about what was going on, not I want to be stuck in this diagnosis and I want to stay here and only here. It was for, but it's always an assessment when somebody starts using complex medical terms very fluently. They've obviously had exposure. They can speak the language. I have to assess then why. And I think with you in particular, it became very clear that it was just, long-term chronic illness and exposure and fluency in the language, and obviously smarts, right? Like you have the intelligence to do your own research without being stuck or identifying as it. You wanted to use it as a way we could communicate, not as a definition of yourself.
Oh, I love that. Thank you. Because that was my heart behind it. So the fact that
Yeah.
came through is
Yeah.
really, really helping me. So you can tell when a patient's knowledge comes from lived experience versus an internet search then? Can you pretty much tell, or does it take
Not
a little while?
always, but yes, the majority. Yes, the majority. And it's humbling because I can, 4 years of medical school and 3 years of residency help me have a more expansive conversation than a Google search.
Yeah.
However, there are diagnoses I have not lived through. So by a lot, right? I have my own medical diagnoses, but limited. Luckily, I've not been hugely traumatized by the medical world, and so it's a very humbling phenomenon to be with someone who has a lived experience through medical trauma or medical process or disease or however you want to convey it, that I have not been through, and even then sometimes have only had limited exposure to, right? So I've had hundreds of thousands of patients with type 2 diabetes. I treat it all day long. And so I know it in and out. I can, or with, gallbladder disease or those types of things, I can relate to those problems very well. However, some patients come in with things that are a little bit more rare, and I don't have the expertise. And it's humbling and important that I acknowledge that. And the medical profession doesn't love to train people to say, I don't know, I'm not the expert, but I'm here for you. So yeah, I can pretty much tell right away, and then I have to do some work, and then I have to, keep working and be honest and humble with myself. And some patients, in your case, you were so open and vulnerable, and some patients, they want, they're tired of people either not believing them or not understanding them. And so to have another provider say, I'm not the expert here, can sometimes be really hard for them. And I hate that because it's my truth and it's the honest thing, but sometimes it can also trigger a response of nobody knows me, nobody understands me, and that's
Yeah.
tough.
But you're so great at like referring people out
Mhm.
to specialists. And I just love that, that you actually take those specialist referrals so seriously.
Oh yeah.
And so I really, really appreciate that about you.
Oh good. Thank you. Yeah. I want to treat enough and I want to be present enough, but I know my limitations. Thank God.
Yeah. Oh God. I want to go a little deeper now. So
Oh.
from your medical and human perspective, what does healing actually mean? Especially for a patient with chronic conditions where there isn't a cure as a
Mm-hmm.
goal, or there's
Mm-hmm.
nothing, my life, depending on what I put into it, can be as great as I want it to be, or as, limited as I want it to be. But like the cure
Mm-hmm.
isn't necessarily a goal in
Mm-hmm.
my, so go ahead. What do you think?
Gosh.
Tough one, huh?
This is ever evolving. So I would be fascinated to know, because you talk so much about healing on your podcast, that it'd be interesting. We could spend probably the entire time talking about what does healing mean.
Right?
And I think it's evolving. So I just want to be really upfront that
I love that.
don't what I thought 15 years ago was healing is nowhere near what I think healing is today. Much like probably 20 years ago, I would have said to you, I believed in forgiveness. And now I believe more in creating a new relationship to pain and to trauma and to sadness. I think forgiveness is not a concept that I love because it feels finite
Yeah.
and maybe, you know, black or white. And I think healing is exactly like that. Well, not exactly, forgive me. It's very similar in the sense that healed sounds like an endpoint, much
Right.
like baked, much like forgiven, much like sober. It's an endpoint. I am healed.
Yeah.
And I think that healing is a great word because it indicates an ongoing process of newly of integrating your body with a new input, right? So if we take the quote unquote easy one of healing from a surgery,
Right.
it was a planned surgery, let's say, and now your body's gone through trauma of having to have this surgery, but it was a trauma, and now you're healing. And I think it's a creating the most peaceful, respectful, and honest relationship to that new body as you can. I think that's what healing is in any way. But again, it's still something I'm trying to figure out as I get older, as I have more medical issues myself, and as I sit beside folks whose diagnoses are not, quote unquote curable, right? More and more chronic disease. I think it's management and peace and balance, and I don't think it looks the same with every disease state. I don't think it looks the same with every patient, and I definitely don't think that there's a measurable endpoint that it looks the same for everyone, and so that makes it harder to participate in as a medical provider with 20 minutes, but I
Right.
try.
Oh, I love that concept of just a like an ever changing relationship with the body that you currently have.
Yeah.
And its current state. So, like on a day when symptoms are particularly difficult, then we as a team get to decide what success looks like.
Yeah.
I have had to just redefine what success looks like for me, even down to
Mhm.
like what kind of day it is. Like, okay, I woke up with a migraine today. So that's now a yellow day. And now, so that means everything that I would do on a perfectly green day
Mhm.
is off the charts, off the schedule. You're now limited to this number of things that you can accomplish today. And that's not normal for me. I just, this is just stimulating so much for me because, especially through these long, hard years of like from 2004 to 2022,
Yeah.
I was constantly in the trenches.
Ugh.
I was, navigating successes, overwhelming losses in my family, also the deep complexity of my daughter's well being.
Yeah.
It's just during that time, my body was in this disease state.
Yeah.
Like, and my only coping mechanism was to overperform,
Yes.
to keep going. The concept of rest, especially rest without guilt or shame, is so new to me. It really is new to me. Literally this week, arguing with myself about resting after a holiday. As I sit here with you, I can't help but wonder or like shudder to think almost, but I'm also stimulated. Like, where might my physical body be today if I found a provider like you earlier, someone who had started managing my stress, and having these deeper conversations rather than pushing through. And my intuition knows it could be so much different,
Yeah.
even just the headaches alone. But like, how critical is that piece for you as a doctor, for your patients to manage stress and rest without guilt?
Oh, huge. I would say up until many years ago, or a couple of years ago, it would have been, do as I say, not as I do. Right.
Right.
So I am by no means the poster child for rest. I like to say yes and to accomplish all the things, and grew up in a time and space where the outward accomplishment was highly prized. And so I'm learning myself. but in my own journey and journey with my patients, right? My patients are a big part of my own journey, right? So I learned from it's part of why I love primary care, is that every person I interact with teaches me something about myself and about the world. And I never want to stop learning. But it's so, 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 so important that people rest. And a large percentage of what I do is teaching people it's okay to take a knee in their lives, to pause, to stop working, to ask for help. It's just not talked about. It's not prized. It's not, I would say, even socially accepted to rest. And I think it makes us all very sick. And so, in particular, with my young adults or young parents, where they come in and they they don't know what to do, and I am oftentimes, and I'm surprised at this, am the person suggesting a leave of absence from something, from work usually, and more times than not, folks are surprised by that suggestion. It never occurred to them that it could be possible that they could take a step back from all the things that are required.
Yeah, because really, how much healing can a body truly do when it's under that kind of prolonged, immense stress?
Yeah.
Really? I mean, right?
Yeah, I don't think very much, and I think, the advent of mobile devices that have a level of stress additive to your life chronically, I think we never rest, right? I think my father made partner in a law firm, and he worked long and intense hours, but he didn't work at home, with computers the way that we do, and I think about folks are reachable all the time. There's very little protected time where we're going home and just being present. We're getting input from the internet and our emails and our text messages. And, it isn't somebody stopping by, it's a text message of somebody needing something. And so you get the input of a need without then also filling your cup with some sort of social interaction. I, I don't know. I am by no means an expert on healing, and I would love to be one, but, do as I say, not as I do, right? I'm still in the process of my own healing around things. I think we do need to rest and to heal and to do the work and to talk to one another about the work that we're doing. And I hope that a small percentage of what I do is that with my patients, because I don't actually know how to get that on a wider scale outside of just the one-on-one interactions. Is like, how do you get exactly what you're talking about? Exactly your podcast of like, how do you get more people to engage in these conversations or even give them time to engage in these
Right.
conversations?
That's the hard part. Because I know that so many people, my listeners and so many people I talk to see themselves in the story of overperforming while their
Hmm.
health suffers.
Hmm.
And so for them, aside from rest, what do you think the most crucial steps they can take to advocate for themselves to find a provider who can be a true partner in their healing?
I think don't settle. I mean, one of the privileges of the where we live. So the vast majority of us, I don't know how many of your listeners are in rural spaces where there's very, very limited primary care providers. But I would say the vast majority of us who are listening have access
Yeah.
to a number of providers. I'd say keep looking.
Right.
Don't be afraid to ask to try somebody new. You have to, particularly I think with primary care providers, specialists are harder, more limited, and maybe you don't need as close of an emotional relationship with the, you know, orthopedic surgeon who's going to fix your broken foot. But I would say don't settle, and trust your gut. So that would be the first place to start: is find someone you believe will fill what you need to heal, and everybody's different on that.
Right.
So if it's just that you need to be able to show up as often as you can, find a provider with a lot of openings. If you need a provider who is very technical in their language, who will do research until they're blue in the face, like find that provider. There are enough providers, particularly primary care providers, in moderate to large, even small to moderate size communities. I think don't settle.
Yeah.
And not everyone is the same. It's like finding a partner. You would very few of us went on the first date and then married them.
Yeah.
So do that with medical providers. I don't take it personally. I oftentimes ask my newer patients if they feel comfortable with me. It's an easier out when I have a male patient, and I'll say, I know sometimes it can be very overwhelming as a male, cis male, to have a cis female provider. Do you want to stay here? I don't take it personally, and I try to give that out. Not all providers are that comfortable, but I don't take it personally if somebody needs to move on. I'm not everybody's cup of tea.
I'm super glad you're my cup of tea.
Yay! Tea!
Now, a huge part of my life that isn't on the medical form is that I'm raising my grandchildren.
Mhm.
And from your perspective, how does that immense responsibility and joy
Mhm.
impact, I'm going to miss this someday,
Mhm.
impact like my physical health and my treatment plans? Like, I know that's a big question. You don't have to go too detailed, but like, tell me how much of that.
I think is an incredibly hard. I think there's a reason our biological clocks, for the good or the bad, start in our teen years, right? So I understand biologically, physiologically, that we were set up to parent, in our late teen years and early 20s. So I have mad respect that you started over and were able to be, find the um, energy, because I do think our bodies change. I think our bodies evolutionarily are really meant to endure a lot of sort of sleeplessness and variation in our routines in our late 20s and or late teens and early 20s. So I think 100% you had to negotiate in your body a younger person's game, to put it that way. Not that you can't. And I think there's bell curve. I do meet 50 some year olds that have more energy than my 20-year-olds. I don't mean that in but I do think, I 100% knew. And these are, I adopted a child as an infant, not a kinship adoption, but I knew, because that children who come from trauma will have trauma.
Yep.
And so on top of having to have the energy to parent again later in life, you also knew from the get-go that these children would need more.
Yep.
Much like parents of children with disabilities.
Yep.
You knew it. And so it was not just energy, but you knew you had to put energy early into their own healing and recovery. And I'm surprised you did any healing during that period of time. It's super impressive, because I don't know how you handled all of that. And plus your own body, your healing through menopause as the hormones disappear.
Yeah, I know. And like also getting diagnosed with primary immunodeficiency
Right.
in the middle of it.
Right.
Like I had a 9-month-old
Yeah,
that I was caring for.
I can't even. Mm-mm.
And learning to do my infusions, oh my gosh.
Yeah.
It was a lot. Okay, so how have you seen the connection between my emotional and my spiritual state and my physical well-being over the years? How have you seen that like tripart of me connect, like grow, the physical, emotional, spiritual side?
Yeah, I would say you were, and I don't know, because again, I'm newer to your life.
Of course.
You had that awareness the moment I met you. You knew that, parenting your grandchildren and your daughter's journey, you knew that was unbalancing you at the time.
Yeah.
And you had incredible awareness, and you knew that it was having an effect on your physical state, and you knew it had an effect on your emotional state, and you just had that awareness. So I don't know how that awareness came, but it was there when I met you.
Oh.
I think what was incredible, because you don't know, you meet people at stories. And I knew at the time that as you were parenting again, that was one thing, but your journey alongside your daughters, I knew was raw and scary and vulnerable. And I wasn't sure where that would end you. And I think when you say growth, what I see is I wasn't sure if and when your daughter's journey trajectory started to move in a positive direction. I wasn't sure if you would continue to live in the past of what had happened. And what I've seen recently is that you've moved along with her. And you always hope that for people is that they can heal.
Yeah.
They can create a new relationship to traumatic years and say, yes, these were traumatic years, but we can move forward. There is space and love and potential for all of us to move on a different path. And so that's what I've seen is I'm sure it was there. It's just I didn't know. I wasn't sure where that story would go for you.
Right.
And I've seen your health get better as that has been true. As her journey started on the uphill and your medical diagnoses were made, but there was more peace, and you were open to the idea of letting it be a story in the past that you could work on, but not somewhere you need to stay. And I've seen your health again, not healed, not cured, not done, but more streamlined. You're definitely more streamlined than when I first met you. And I
Yeah.
feel like despite you saying, oh,
Yeah.
like
Here.
I think if your infusion, if I had met you, even maybe 3 years ago, if the infusion had been that late, it would have been a bigger spin.
Oh, yeah. I would have had an ear infection, had
Exactly.
another tympanic membrane rupture.
Just another one.
Just another one.
Just another one.
I only
Yeah.
have a few.
Yeah.
That's so cool. And, I appreciate so much of everything you had to say. And I think some of my specialists make sure and point it out, like my pulmonary doctor. He's
Mhm.
like, you are just an atypical patient, but in the best ways. He's like, typically I see I met him when I was 45. So I've known him now 11 years or whatever. Normally he sees a decline as they get older, and he sees me doing things like 10Ks and, stuff like that. And I don't know. I just think it's really cool to be able to say, I know firsthand that you had a big part to play in that because you listened. When I walked in sobbing, going, I can't live like this anymore. My eardrums are rupturing every couple, whatever, just constant pneumonia, all the things. Like, get me help, and you did.
Yeah.
And so, I think we all can allow the stress and the weight of it to pull us down. And even though that component you brought in, like where you've seen my health increase over the last few years as my daughter's trajectory has changed too. Like you can see that on my face. There's less worry on my face. I remember just the other night when it was cold and I got to pull an extra blanket over me. I used to feel a lot of guilt that I was pulling extra blankets on me and I didn't know what she was able to do.
Right.
And so now I get to just let some of that go. And we do see how the physiology responds. And so, and also me prioritizing real rest, not just laying on the couch and handling emails from my phone.
Right.
But like really setting the phone down and actually letting clients go unanswered some days because I had to turn off my phone and people aren't used to this. And so it's been a beautiful uncovering and like unraveling of the pace of my life. It's so cool. So I'm titling this episode Unpacking Wholeness.
Yeah.
Because that word resonates so deeply with me on a lot of levels. And I know like healed is not the outcome, but we can be whole in the process, right?
Yeah.
Even if we're not completely integrated all the way, we still can form a whole being. And so from your perspective, having witnessed the journey, what does that word wholeness mean to you in the context of a patient's life and health?
Yeah. I mean, I think integration is a beautiful part of it. I think it's acknowledgement at very minimal of all the parts of you: physical, emotional, spiritual, positive, negative, solid and stable, and those in epic transition.
Yeah.
I think there is a Buddhist component to this of non-attachment.
Yeah.
Of what your wholeness is, right? I think we like as human beings to identify what our wholeness should look like our identity and completeness. I am a complete person because I am these things. And if one of those things falls off or is unable to be part of our being anymore, that we're working on non-attachment. also something I'm currently in the middle of working through in my own life. Yeah, I think healing goes along beautifully with wholeness
Yeah.
and the non-attachment of being able to not accept, to greet every new phase with some curiosity.
I love that.
Well,
I know it's not fun.
no, it sounds lovely. Can we now practice it? What
No.
is there a pill for that?
Yeah. Um, so do you think the biggest area of my reconstruction or repair has been in how my relationship with my daughter? Where do you think the biggest, like, I don't know, if you look at the trajectory of my healing journey in the last, 10 years,
Yeah,
what do you think? What do you think has been um
I would be. I feel unqualified to answer that for you, but I do think a big part of it had to do with your daughter in the sense of you're just such an incredibly connected human being that having a connection that was temporarily severed was agonizing.
oh yeah, that was rough.
Um, so I do think that that's a huge part of it. I think that you were thrown into early parenting again, as we said, like your body was undergoing stress and then and then you go into the stress of early parenting. I think like your nervous system must have been on fire
Yeah,
for years.
decades,
Yeah.
really. I'm still trying to teach myself to just like not breathe shallow.
Right. So there's, your daughter, but also just like your kids are older now and they don't need as much. And I do think there is some healing that can be done when you have a little bit more space. And older children, you can shut the door and say, "Hey, mom, it's gonna take a minute. I'm gonna take
Yeah.
some breaths," and you're not as worried about them, letting something on fire. I do think,
Have you met my kids?
yeah.
Sorry.
I know. No. I said less likely, not 100%. I know. I have a 14-year-old and
Yes, you
he's not
do.
allowed to use anything that involves fire when we're gone,
Yeah.
out of the
Oh,
house
bless you.
because, woo. But I do think you were in the middle of all, perimenopause, your own illness journey, the disconnection from your daughter, parenting young children. I think, what do you call it? A pinnacle? What's the opposite? Like you read the black hole version, where everything was just kind of sucking south. And
So good.
I think the stabilization allowed space.
Yeah.
But again, it's only from an outside
Yeah.
observer. So I hope that I have not treaded on anything that seems
No.
inappropriate.
No. And I kind of feel like I would have found my way here one way or another,
Yeah.
just because I'm the scrappy, scrappy,
Mhm.
get it done kind. And so I don't know. I just think that's really cool. If you have a hope for me as my doctor and my friend for this year coming forward, what are you hoping for me?
Mm, that's interesting. I think as your medical provider, I want, continued healing, as we
Yeah.
just talked about. I think I want continued space to do the work because, like you, I'm scrappy and I like the work, and I know that you won't avoid it. So I'd like continued healing. I like continued space for the healing, um, which sounds more peaceful. And I think as your friend, I'm excited for the non-peaceful moments because I do think that those create some of the beauty that we are. So I think it's a sort of a contradiction if you were to ask.
Yeah. It's like Andy Grammer's song. I hope you have pain or I hope it hurts or something
Yeah.
like
Yep.
yeah. Yeah.
Yeah.
Oh my goodness. Morgan, thank you so much. This conversation has been a gift. Thank you for your willingness to step into this space with me with such openness and vulnerability, letting me throw you the hard questions. To my listeners, I wanted to have this conversation because the relationship between a patient and a doctor can be one of the most sacred spaces in our lives, especially if we're on a long journey of healing. In a system that can often make us feel like a diagnosis, a number, or a set of problems to be solved, the greatest gift is to be seen as a whole human being. So, Morgan, your care has been a safe harbor for me. You've been more than a physician, you've been a partner. You've been a key part of my own unboxing, helping me hold the pieces, make sense of them, and begin the work of reconstruction. You see the person beyond the chart, and that has made all the difference. Thank you for your wisdom, your advocacy. It has been a gift to my world. To everyone listening, may you find partners on your own journey who see all of you. May you have the courage to share your whole story. And may you continue to do the brave work of healing. Until next time, keep unboxing and carry on, comrade. I love you.